The Birth Circle podcast features experts in all the nuanced areas of pregnancy, birth, and postpartum with the aim of helping women make the choices that will keep them safe, healthy, and empowered. We respect all birth choices and believe in supporting informed consent and evidence-based practices. Nothing said on this podcast should be taken as medical advice. You should always seek the advice of a competent professional for your care. Welcome to the Birth Circle podcast.
This is Sarah with Birth Circle, and today I'm so excited to have Marcia Stevens. And Marcia, I had the opportunity to attend her birth, meet her about 5 years ago as she was visiting the United States to give birth and to work with the School of Midwifery out here. And Marcia is a nurse. She's been a nurse for 18 years. She lives in Liberia, and she has 4 girls. So thank you so much for joining me, Marcia. I'm so excited to talk to you
Thank you.
and share you with the
Yeah, I am
world.
too. Thank you.
There are so many quotes that I say in my life that come from Marcia. Like, as you can imagine, sitting at her feet 5 years ago, listening to the stories that she has to tell, that a lot of what guides my goals and my ambitions in helping Birth Circle, um, helping birth women all over the world through the tool of Birth Circle has been set up by Marcia. And I'm so grateful for her kind of imprinting on my head so young. And so I'm excited to share her with the world. So thank you for being willing to be on the podcast.
Thank you too. It's a pleasure.
Okay, so tell us, how did
Yeah.
you get your background? You've been a nurse for 18 years, but how did you get your schooling, and then how did you get interested in birth?
Okay. My late grandmother was a home birth midwife, a traditional birth. And coming up as a little girl, I was always by her side. And so I was always helping. I was always helping her when she's helping the mother in giving birth. And then I took to the job and I felt that I could do it. And so I went for it and I told her that I wanted to be a nurse. And I went for it. She supported me. I graduated from high school. I went to nursing school and I did nursing. I was doing nursing at the same time doing the midwifery. So, like I said to you earlier, I'm an apprentice midwife, but I am a registered nurse. And that's my passion. And I enjoy helping everybody, including the mom having the baby. Yeah.
Yeah. So what are some of the challenges that you have in um your particular community with regards to birth? Because I know when you were out here,
Oh,
you were making plans and building a clinic in your front yard. So what are s-
yeah.
tell us about what it's like to give birth in Liberia.
It's a difficult thing because Liberia is a poor country. A lot of people can't afford. The government hospitals here are not doing too well for the citizens. So if a mom is having her baby, she can't afford to go to the private facility for healthcare. The government facility are not up to date, so it's a problem for them because if they don't have money, they can't have the baby there, and because of that, some of them have their babies at home with unprofessional people. Some mothers lost their babies, some mothers lost their lives. And seeing myself, my passion, I go for it. I do a lot of birth without pay because these people need help. I can't
Mm,
see them there yet, and I can't help them. So I deliver a lot of moms without getting anything from them because my passion is to help. Of course, I need money, yes, but I can't just sit there and I can't help.
yeah.
So in my backyard, I had a mini home clinic that I started where I do the birth, and so the courage to build a clinic in my yard that I could help more. Personally, I have,
I love that story. I
yeah,
mean, talk about
yeah,
in the United States, you could never do that, zoning laws, but I love the fact that you see a pain in your community and you build a clinic in your front yard. So, but
yeah,
basically, you're saying that there is no, the welfare there is so poor that the system is so broken that if you don't have the money to pay for a private hospital, you're basically
mm,
left to your own devices.
yeah. True,
So
yeah.
so there are not so what's the training process for midwives? You call them granny midwives, right?
So
Or
the yeah, so the granny midwives said, or the TBA, we call them traditional birth attendants. Those are women, those are granny that didn't go to school to learn to do delivery. Yes, so they just stay home because they are mom and they are women and they should be there when their daughters and all the girls, the ladies are giving birth and they are there just there helping them. They are not school for it. There were times before the war because Liberia had civil war for 14 years. So before the Civil War, these moms were just there helping. They didn't go to school. And that is the problem because they didn't go to learn midwifery. The government don't see them fit to do delivery, to attend birth. But they are
mm,
still doing it. They are still doing it because there are some areas where you don't find clinic, where you don't find a midwife, where you don't find a nurse. But yes, a woman who is pregnant and needs care. So some mother there is going to attend to her and take care of her, and she will have a baby. And some are safe, some are not. I mean, because when there's complication, they can
they don't know what to do.
and they don't know what to do. They will do what they feel they can do, and sometimes the mom don't live, the baby don't live, and sometimes both mothers and baby live like the twin I told you about. They were joined back to back, and they live. And she
This
had
is
a
a story.
normal.
I know this is
And
a crazy story. I'm like, I heard a story about a granny midwife who delivered conjoined twins vaginally and everybody lived.
everybody live,
I
and
want to
because they were yes, because they were joined, and that's when the mother left the bush and came to town for the doctors to separate her twins. And God bless her. Yes, there were some Americans here at that time, and they took those children to America. And as I speak to you now, the American citizens they didn't come back to Liberia. They're just still there with their mom. And
Oh my goodness.
oh,
That I
seriously.
mean, my babies had big heads, but I didn't have conjoined twins. I
Yes,
have to ask, where were they conjoined? Do you know?
their back, lower
No, oh,
back,
you said
back,
that. You're back. Oh my
back,
gosh. Oh my gosh. Oh my gosh. That hurts. That
back
hurts.
to back, Sarah, back
Oh,
to back. The two back facing two back to back. I can't imagine how they came out, but
oh,
they came out.
and nobody. Wow. And so this speaks to the skill that some of these granny midwives have.
Exactly. That's so. So we should be helping them. That's when Sherry and Dee came to Liberia and they thought about that. They said these women are important, so we need to go and see them. And so when Dee and Sherry came, we went to a rural area, a place where they call Babolu, and we invited them. They came to meet me, and we were happy to work along with them. And Sherry and Dee prepared some birth kits for them. I
Uh-huh.
mean, like, yes, and we and divided it out to them, and they were so glad that they received it because they went back to help their hometown, to help their children, to help their community. That was good. Yeah.
One of the things I remember you saying was that in some of these places, they won't have access to clean water or safe tools, but they'll have access to a smartphone, right? So,
No, there
no,
are some places they won't have cell phone at all.
oh, they
There are
won't have cell
some
phone.
that not at all. Some places no. Some
Nothing.
places yeah, nothing,
So
nothing.
what is do you think is the most important tool to have, that like if you could have nothing else, what would be the best thing to have in a birth in the
The
bush?
birth, the birthing kit, Sarah, they need a birthing kit where they will have, I mean, those instruments used for delivery. And we could think about going from place to place. I mean, with the focus of the ministry, with their with talking to them about it and encouraging them to empower these moms because they are doing great jobs out there. So we need to empower them. Birthing kit, they need birthing kit where I mean materials, yeah, tools that they can use to help a woman. I mean, have a birth, have a safe delivery. They need them. Even like
What?
you talk about the phone, they need phone too. Yeah.
Yeah. So what's in the birth kits?
Okay, the forceps, the scissors, clamp, scissors. Yeah. For I mean, where you help to clamp
Mm-hmm.
the core tie for the umbilical cord when the baby is born. After you separate the mother from the baby, you clamp the cord. You need medications too, like the oxytocin, the echometrum that some mom will need, yeah, just in case of bleeding to help for the cervix to contract and go back to place. Yeah.
So these are just
Okay.
like basic medical supplies we take for granted here.
Seriously. Yeah, towels, sanitary pads. These are things that the mom needs and they use. You know,
And is it hard to get these supplies in Liberia? Are they like what makes them hard to
They-
get?
okay, some of them are not so, like, especially like the personal thing, like the towel, the sanitary pad. Like I say, a poor woman can't afford that.
Mm.
But someone who is working, I mean, like the city, they can afford that. But there are some people who just can't afford that, but they are having a family. And so the government hospital should be there to help, but sometimes they don't even have that to help the moms. So just imagine that. And we
I
who see as need is a burden on us, and we trying to do all we can do
The
to
people
help.
in the hospital, I mean, I can't imagine working in a hospital where you don't have the tools you need to take care of your patients. So does that just
Exactly.
make the staff
It's
just
pretty.
make them so angry?
Yes, true. There are times that even the staff get angry, and sometimes they say they can't work because there are no tools to work with, and so they don't want to go to the facility to do the work because you can't work with all tools, right?
Right.
You can't work with all tools, and so
Hmm.
sometimes we have these problems. Yeah, so it becomes difficult for both the client and the healthcare worker. Mhm.
So what is causing the shortage of birth supplies or supplies? Is it that the hospitals don't, they have policies against helping the poor? I mean, it's
Oh,
so
yeah, no,
different than
no.
here.
Yeah, it's so different, very, very different. Yes, I mean, at one point, I would say, one of that, I would say is negligent on the government part, because these things are things that should be provided for your citizen. Our government are not really doing that, to tell you the truth. And sometimes we have a lot of NGO, a lot of different people come in to help, but it's just sometimes for a shorter time. Sometimes the time the people will come and be here for, all will be well. But when they leave, it just go on for some time and then
And then you run out of
is
supplies.
it run out of supply. So it's like we can't do it by ourselves. I mean the government. But there are some individuals, I mean, like me, I'm running my own clinic, so I try to make sure I have these basic supplies. So there where I come in to say that I will need help. I mean, being my friend and interacting with you, I will need help with my clinic if I can just have some support with the little resources that I have that I'm putting together. I tell you, Sarah, we're going to help a lot of mom and we're going to move forward and do something great.
Because there are people there ready to work, and there is access to these supplies. I mean, it's not like it's illegal to import gauze into Liberia, right? I mean, you have
Yeah.
these supplies, they're just not being able to be purchased by the people who need them, because like to be so poor that you can't even afford gauze or a towel, or that to
Yeah.
Americans is unbelievable, because you can go anywhere and pick up any of these things. Like, people will give them to you. You go to the emergency, like, for an American to be out without gauze is pretty much impossible, right? Or a towel or something clean to wrap a baby in. And so, like, it just wrapped my head around, we just say, we'll just throw more stuff at them, just ship more stuff to them. But it doesn't work that way. That doesn't solve the problem, right? I was going to ask you, the NGOs, the non-government organizations that come in humanitarian tourism, like, there's a
Mhm.
lot of criticism for humanitarian tourism, but tell us what you feel like. How do they impact the community there?
They impact the community because when they come, I mean the community is so happy. The government receive them wholeheartedly and embrace them and say, oh yes, what you are here to do, what you are here for will be rewarding. But I mean it's not the NGO who has the problem, it's us. It's us, the citizens. Because the NGO, take for instance, if you are willing to help me, I should be willing to, right?
Yeah.
Vice versa, you are willing to help me, so I should be grateful and be willing to work with you. But Liberians, some of us, some Liberians are doing all they can do to help. But when it is left with the government, then it becomes like politics. Like they are the one bringing the NGO. They are encouraging the NGO. But if you are encouraging the NGO and the NGO comes in to help, and the NGO set a pace, and you should continue and you should follow up, right?
Mhm.
But but it's just not going that way. And there are few people that really want to make the difference. And I'm one of those.
Yeah.
I'm really one of those.
So why do you think that the government doesn't is did the NGOs come in and try and teach how to do things that aren't
They-
really Liberian
yeah,
culture, and so then they aren't adopted? Or why isn't it easy to take what these NGOs do and continue the work?
I would say they just don't want to do it because when the NGO come, they do a lot of training. They empower us. They empower our people. They train us to do it even when they are gone. But sometimes, I mean, like I continue to say, sometimes the head will do R7, right? When they see the people, they act like they will do it good. But then when the people leave,
They go back
they
to their
don't.
ways. Oh
You
my gosh,
Yeah,
that's got to be so frustrating.
it is so frustrating. So few Liberians, I mean, there are few of us, other people trying to, they are trying to set standard, they are trying to make things happen, and we are getting there little by little. But if an NGO come, they pass through the government, they don't come like they come in alone. So, for instance, a clinic that I'm trying to finish, I already have a clinic that is established, and my clinic is, I mean, registered with the government. They know that I'm doing this business. They know that I'm a nurse. So if someone comes in to help me, they're not going to go to the government. The government going to be aware, yes, I have this group that are coming to help me because I have a clinic that is already established. So it's not a government clinic. It's
No,
not
you're an
private clinic.
individual. You're an independent clinic.
Thank you. And so I'm helping the citizen. That is different. But when it is under the government themselves, they don't really do well. And that is so frustrating. So healthcare in Liberia is one of the devastating things that our people suffer from. And
So
I'm
you're
praying and
saying
hoping that
there's so much to be improved. So you're saying that the NGOs that come and help independent workers like you, they're able to make more of a difference than trying to go through like
yeah,
government channels, because the government channels, they just kind of fizzle out after the NGOs leave. But
yes,
NGOs that come in,
yes,
because when I'm trying to understand a hard concept like that's so foreign, like Liberia is so foreign to me, I try and like flip it. If you were to come to me in America and try to teach me how to give birth like the granny midwives give birth, it would feel very confusing. It would be so different, and I would have a hard time adopting it. Like I would have a hard time changing. Is that what it is that we're taking Western medicine, we're taking American way of birthing and bringing it and pushing it? Or is it literally they just, what is it?
no, it's not that it will be so difficult. It's just that there are some things that we, and because I mean every day we learn new things, right? Right now it's technology work, and like before, like now, if you go to a clinic in America, you do all on the computer, right? You register the
Yes.
patient on the computer, you
There's a
save that,
perfect
right?
example, right? So if we're teaching you have to do it on the computer and you don't have computers or it breaks, then the whole system breaks.
Thank you. So, so there are clinics here, there are hospitals here that are still not, I mean, registering the patient on the computer. They're still doing it. I mean, with notepad or just on the hospital card. Yeah, so it's not safe in the computer, right? But it's being recorded with pen and pencil and sheet. So they come and teach you how you save patients' document on the computer, which is something good. So even if they come to this facility and you don't have an ultrasound machine where you can do scan, like my clinic now, I'm working on that. I
Ultrasound.
will want to, yeah, because you need to see the position of the baby, right? You need to check when the baby is still in utero, right? All moms should do ultrasound. I mean, ultra scan when they are pregnant, right? Right?
But yeah, if there's something that you're concerned about, for sure, if you don't have that equipment, that's really hard for you to.
So, so there you go. All of the clinics don't have scan machine. Even as I speak to you, I don't have one.
Okay,
So
so
I
the NGOs come in and try and teach you how to do better practices, but you can't even
think
implement the practices because you don't have the equipment.
yes. So they come, they bring it, they leave it. We work with it. But if it's poor, it gets damaged, the
Yeah, then it's
government
broken, then you
can't.
don't know how to fix it. Oh my gosh.
You don't know how to face it. You can't afford to buy another one that you will use. So these are some of the problems that we have,
Hmm.
and I really want to work on that to see how we can improve our health system.
So I mean, yeah, there's no doubt that the scans are helpful, but is there a way that that midwifery could be, I don't know, like that midwife that delivered the conjoined twins, those are some
Uh-huh.
serious mad skills. Is there a way, like, would she be able to teach other midwives? Or like if the NGOs came in and instead of saying this is how you do it better, if they came in and found midwives that were doing it better and
Uh-huh.
helped them teach, would that work better? Or
Yeah. Yes, that's yes, that should work better. That's supposed to work better because that's empowering her and helping her to improve in her skills. She has skills.
yeah.
She has some skills, yeah. So she
She
should
has
be
mad
pushed
skills.
and encouraged.
Yeah. She should be like the university. Everybody should come apprentice her.
Okay, so like that. So the government said, okay, send a midwife don't know how to handle complication. So they agree that the moms will go to them, but if the mom goes to you, then you come along with her at the health facility.
Oh, so she can bring the midwife with her when she goes to the health facility to kind of like continue the care.
Because midwives to bring the mom at the health center, at the clinics, at the hospital, instead of during the delivery at home.
Okay. Because here in the United States, home birth is actually really safe and it's on the rise,
Yeah,
especially with COVID. But in places like Liberia, it's actually
it's not.
not the
It's
best.
not. They don't use sterile. They don't use sterile.
Nothing is sterile. Yeah. Well, even our homes, we would have access to clean water here in the USA.
You know, you need. Those are some of the things that we are going through. Those are some of the problems that we have.
Wow.
Yeah.
So you're working on this clinic. You're still building this clinic in your front yard, or what's going on with the I I just love that it's in your front yard. You have no idea how much I love that. I love that you have
Yeah.
the freedom. Here's what boggles my mind. I love that you have the freedom to fix a problem you
Uh-huh.
see by building a clinic in your front yard. And I hate at the same time, I hate the fact that you can't even like get the supplies for your clinic you need because of the way it is. So it's like whenever I get mad at city zoning laws, I also do construction here
No.
in the United States. I get so frustrated with zoning laws and then I'm like,
So,
but I can get gauze anytime I want.
yeah.
So,
So the difference is for us who are operating our private clinic, we try and get the supplies. We have them. We purchase them. We have them. But the government facility should be free for the citizens, and they don't have it. That's the difference. You understand? The government facility, we have private facilities, we have government facilities. The government facilities are, I mean, actually, the drugs, the things there, the supplies there should be free of charge for the citizen because the government is responsible for that. But a lot of time they don't have it in the government facility, which is supposed to be free. So they come to the private facility that that is not free. So we try by all means, but it's not free, but still sometimes we still give it free because they don't have it. They can't
mhm.
afford. A mom will not come to you, she needs it, if she doesn't have it and you send her away. No. So you see, so there's more burden on the private facility than the government facility. And the
And does
government facility, yeah,
the government kind of knows that's what's happening, and so just lets the private facilities take care of it?
they
Great.
know, they know. It's,
Mm.
yeah.
So is your clinic a birthing center or is it all types of healthcare?
All types, not just clinic birthing center, all types. Clinic, we have a birthing center, we have, areas where you see other patients, both male, female, children, yeah, even the different hospitals. But if the clinic is little, because usually here the clinics are little, just one or two are big, but they have different sections, not only the birthing part of it, they have different sections
Mm.
where you do immunization, they do the birthing, they do other medical thing, they do the dental, different. Yeah.
So how do you get funding for your clinic?
Sarah
She's making a
is
face.
my my very self. There were times long ago, 5, 6 years ago, 7 years ago, once in a while the government were helping the private facilities. They used to. but they are not doing it. There were times they would give some drugs, like the malaria drug, because in Liberia we have a lot of mosquitoes, so we have, people come down with malaria. They were giving malaria drugs. They were giving antibiotics. There were times that they were helping, and these drugs were brought in by NGOs again to help. So they were doing distribution every month, but all of a sudden it stopped. They are not doing it again, and so
Is it
we
stopped because
get
of COVID?
no. This for their own reason. I can't answer that for them because we try and went and ask. It was not. It stopped long before COVID.
Oh,
It
really?
stopped long. It stopped long before Ebola. That was just their own thing. They just felt that they shouldn't help again, and they were not helping, or they are not helping again. And since they are not helping, we have to go for it ourselves. We have to do it. Even when they were helping, it was later. We appreciated it, but we're still doing what we had to do. But
Mm,
now it's not coming at all. So it's just the month, the little we receive from the patient when they pay for the drugs for the lab, we go back and buy drugs. But the clinic is being run by my very self. No help.
wow. But
Yeah.
there are many other clinic owners like you all over the country just
Yes, yes,
trying to provide
yes,
services,
yes,
and the
yes.
government just doesn't care. No. Because if
No.
the members of the government get sick, if the people in power get sick, they just go to a private hospital and they can pay, so they don't worry.
They go to private hospital, they get paid. They don't worry. They have money. They fly out of Liberia and go elsewhere. They go to Ghana. They come to America. They go to India. They go to Nigeria to seek health care. Yeah, it's your country that need the health system need to be improved. You should see reason to help improve it instead of you flying out. So if a Liberian doesn't have money to fly out of Liberia to seek health care if they are really ill, tell me you know what happened, right?
Yeah. What will
Happen.
happen?
So that's what we are in here.
And
Yeah.
how do NGOs, when they come in, how do they know which clinic they should work with versus which clinic is just being run by people that don't have the best interests in
So
mind?
so like you know me now. Like you know me because we have interacted, you know that I have clinic, and I'll ask you and say, Sarah, I'm having this clinic and I need help. Can you find a way to help me? Maybe you can talk to people in Utah and say, look, I have this friend like girl who has a clinic and she needs help, blah blah blah. You explain what I've explained, and you decide to say, okay, I'm coming to help Marcia with her clinic. You come to help me.
Hmm.
Yeah.
So
If you don't know
so it's
anybody and you just
connections. You're saying it's connections.
connection. It is connection.
Mm.
Connection.
So
Yeah.
I know you through a third party, but how did you first get your connection to the United States?
Okay. So when Sherry and Dee came, it was Dee. When Dee came to Liberia, she came to adopt her son, right? Peter. You know Peter, right?
Hmm.
Okay. And she was here for a longer time. And being a midwife, she just didn't want to just sit home. So she asked her host by then if she would be going to a nearby clinic or hospital just to, have an idea of how we do delivery. And her host is my friend. It's so her
Oh.
so her host said, oh, I have a friend who has her own clinic. So I will contact her. And that's how
Hmm.
that's how she contacted me and told me about D. And I went to see D, and D said, "Oh, but can we do student exchange? Students from America can come to Liberia. I mean, for affiliation, we call it here. I mean, practicing before graduation." I said, "Oh yeah, that would be great."
Mm-hmm.
And so with that, I was able to carry them to the Ministry of Health, and we met with some of the bosses, and they were waiting. And so that's how Sherry and Lola Sonja came in with D. So D went back and came along with students, with Sonja, who was a student. And then I didn't do that on my own. So I had to go to the Ministry of Health to inform them that I had some foreign friends that are midwives, and they were here for some time. And so they wanted to see the different, I mean, the way we do our delivery, our culture. And
Mm-hmm.
so so the government agreed, they didn't mind, they agreed to that. And so D and Sonja and Sherry, they were going to the hospital, I mean, observing, helping with birth. And
Oh.
yes, so they went there, they went to the big government hospital here, and they saw how we do our delivery, they saw our tradition. They went to my private clinic, even though it was small. They didn't attend a birth at my clinic, but they attended a birth at the bigger hospital. And so that's how I came in contact with them. And so when they were leaving, Sherry asked me, "Have you been to America before?" I said, "No. Would you love to come and visit?" I said, "Yes." And she offered me, she went and sent me an invitation, and I was given visa. That's how I went to Utah.
Oh, that's so cool. I'd never heard that story before. And you gave birth
Oh,
here, and
yeah.
I got to film
Yeah.
your birth, which was
Oh, yeah.
so
And
cool.
so I went to Utah 2014 just for a month. And guess what? When I went the first time, I'm in Charlotte. I was going to the hospital, to mountains, right? How do you call the hospital there in Utah?
Yeah, the
Um,
hospital, just the medical
yeah,
center. Hmm.
yes. I went there. I was just shadowing. I was following Jennifer. When Sherry talked to Jennifer, and
Hmm.
when I was at the hospital, I was going to the hospital every day and just observing
Watching.
how
Oh my
just
goodness.
watching. That's what I was doing. Yeah. So I was there for a month and I came back. And then 2015, when we had the Ebola, and because I was pregnant, I still had visa I mean, my visa was still valid. That's when I went back and had my baby. So I went to Utah 2 times.
Yeah, to have your baby. Wow.
Yeah.
Okay,
Yeah.
so do you feel like that's a really cool way? I mean, it's not like we can bring every midwife to the United States, but do you think that made a bigger impact to learn here on the ground, like immersed in our culture versus our culture trying to go over and like spot teach it? Do you think
Yeah, 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 yes.
like
In
because you
fact,
get
while I was there, I shared experiences. I went to the midwifery school in Springville. I went there, they invited me. I spoke to the students. I
mm-hmm.
went there. Yes, I talked about the difference that I saw with us giving birth here and there, giving birth there. I share my experiences and I had a wonderful time. I talked to the
Yeah.
midwife, the students there. Yeah, I visited the midwifery school there. And
I've
that
got
was
footage of
really,
that. Maybe we can get permission to publish that. That was a very interesting presentation, I remember. Yeah.
yeah.
See, Marcia is very much imprinted on me. um, so it seems like your connection with Sherry was pretty happenstance, or D was pretty happenstance. Like it just kind of happened. Is there any way that we could two cultures come together and create more of these on purpose connections?
Yeah, yes, we can work it out. Cause I mean, I tell you, Sarah, seriously, we still need help. I need help to help my people, and I would love it if you guys, if I can find sponsors there or NGO that I can help me improve improve. In fact,
Mhm.
as time goes by, I even want to improve the clinic from just clinic to health center and maybe a hospital in the future. But me, I want to leave one stage and go to the next because all along it has just been little, and so I'm thinking and planning to see how I can improve it a little to help more because the bigger it gets, the more people I'm going to help.
Yeah, yeah,
Yeah.
for sure. And then the more connections that individual providers can make with those, because I am really sensitive to the fact that I feel very strongly that the granny midwives, the knowledge that you have in your country isn't subpar to the knowledge we have in our country. The only difference, we have ultrasound machines and we have sterile blankets, but really, if a midwife can, nobody in America would deliver conjoined twins vaginally. So, like, I would say that the skill level of your midwives is
Yeah.
completely, if not better than the skill level in a lot of ways of our providers. It's just the difference in
Seriously.
equipment.
True. In fact, if that granny midwife, that particular mom who had that conjoined twin, if she was in the city, the doctors were never going to allow her have that baby by herself. But because she was way in the bush, in the village, where there was no health center or no clinic close by,
Mhm.
yes. So
What
the granny midwife,
I'm sure that your granny midwives who have experienced with breech, given the right
yeah,
equipment, they would be the most effective and
true,
safe providers ever,
true,
right?
yes, yes,
So
yeah,
we have equipment and we have a lot of knowledge, but you also have knowledge, and
and no equipment.
it seems like the best way is to just be bringing in the equipment and the help for systems like clean water and helping your birth
Yeah,
culture, your birth knowledge expand the way that works
yeah,
with your culture, right?
true, yeah, true, true. Sarah,
Did you
yes.
feel like giving birth in America was like another worldly experience? Like, as birth providers, were we weird? Were we did we treat you differently? Did we I mean,
Oh, I
did you find it
enjoyed it.
was
I always talk about it. I always show the video to my friends. I say the midwives in America do birth. I mean, just different weeks, super, and I enjoy it. I mean, all the care, the love. Whenever I have the contraction, and I go to they rub my back, and we don't. Oh, that was so
Yep, yep.
nice.
I just loved
We
you
don't
asked.
do that here.
No, you don't do that there. You asked for some gospel music. So we turned on the gospel music and we're like, "All right, we can we can rock to this."
So, so we don't do that here, but all of the birth that I attended with Sherry and
Uh-huh.
D, and with Sherry and D, I saw that, and so I said, okay,
Oh.
when I'm having my baby, I'm going to do that, and that was wonderful. That
So you
was
picked up a
so
little American
I
trick.
Yes, I enjoy that, and so I do that with my mom too. So some when they're in labor, I mean, I'm playing the music, I'm singing for them, dancing, I'm
Oh my gosh, I
praying
love
for
that.
them. Oh,
I love that.
Sarah, you should come. You need to come on one of these trips
Yes,
and see. I'm praying and hoping for that time.
I'm
We
planning
need to
on it.
work that out. You
Yep.
have to come to Liberia. Yeah,
Yep.
yeah.
Wow. Oh my goodness. Do you have any other stories of just birth there? I mean, we have the twins, the conjoined twins, but what else? What other amazing things are happening in the birth world there?
So I mean, we have like my very self. I had a delivery maybe some 10 years ago. It was my first time seeing a mom. So here is another thing. There are some mom that you won't see from the beginning of her conception or her pregnancy. You only see her when it's time to give birth.
Mm,
It happens here too. I don't know if that happens in
not so much.
America, but there are some mom that you won't see they live somewhere else, and sometimes when they are about to give birth, when they reach to, I mean, full term, then they leave their community and come closer, and you only see them on the day of labor. So
Oh.
you don't know anything about them, but yeah, it's the mom who is ready to have her baby. And there are some clinics that don't accept them. There are some that accept them because of their condition. And sometimes you even tell the relative that you have to take your patient to a bigger hospital because I don't know anything. And they are there begging you, please help me. You have to help me. I don't have money to carry her. I can't do this. And sometimes the mom tell you, I can't walk. I'm not able to go anywhere, so I can't go. I'm gonna have the baby right here. And you stay right there and help her
Mm.
have that baby. I had one experience. I did birth. They were twins. Sarah, I tell you, I didn't even know it was a girl and a boy.
You
After
didn't
the
even know they
girl
were
came,
twins?
I didn't know until the girl came. Before I got to know that another baby was there, and it was a boy. And the boy was rich. The girl, she was sure in the right position, but the boy was rich.
Oh,
And
stinker.
she had her babies, and they were fine. The mother was fine. The baby was fine. Yeah.
Wow. Wow, wow.
Mm-hmm.
So,
Yeah.
it seems like the connection you had to the United States, it
Yeah.
am I correct in saying that sometimes the NGOs come and they make a difference and then they leave, but there's not like a lasting connection? There's not a we would call it a sister city. Like growing up on the East Coast, my city had a sister city in Germany that we're like, and we would take care of each other. But it seems like it's kind of like one-sided that the NGOs come in, they help, but then they leave and there's no connection. They don't foster long-term relationships, or is it just my perspective?
Some some do that. They, in fact, they intend for it to be long relationship. Even at the bigger hospital, like the John F. Kennedy Medical Hospital, right right now I work there. I'm an instructor there. I teach in a nursing school. So
Okay.
besides my clinic, I have another job where I go to the nursing school to teach. So I work in a big hospital, but with students. I work with the students. I'm teaching them, some of the midwives and the nursing students. I'm teaching them. So every time there's different groups that come from the United States. Some just come to do surgery. I mean, a particular surgery. Take some will say they come to do just water, thyroidectomy.
Uh-huh.
Some will come for just breast cancer. I mean, just different thing. But some are coming repeatedly. Some are coming repeatedly. They always come. They will come and spend a month or two and go, and then they will come back another time. And some just come once in a while to help and they go. But a lot of times people come, they come. So I mean, what I said earlier was that even though these people are coming to help, but sometimes our people feel that with all this the help, we can't do it on our own. That's why our people do sometimes. And we should graduate from that. We are appreciative that people will come. We should be willing when people come, and we should be able to prove to the people that we can do it even with all them, because I mean you come and teach me to do something, so I should move on and teach more people, and then we can work better, right? That's how it should be.
Mm. And that's how it should be.
Yeah,
Yeah, that
yeah.
would foster the long-term relationships I'm talking about. So you're saying that in one way the NGOs coming um teaches the people that they can't do it on their own, and it almost disempowers. It does the opposite of what they're intending.
Yeah,
Whoops.
but yeah,
But
but
not
if you
you.
come to me, No, not me, not me. I can show you that. If you help me, you're gonna. In fact,
Yeah.
we're gonna be in constant communication, and you're gonna see what you are putting into the clinic to help Liberian citizens. So it's like I would even want you to come every time when you can come to see the progress, to see how well we are doing with the help that you guys can help, or with how well we are doing and how well we are helping our own citizens. But
Yeah,
there are some of us who can do better and who are striving to do more
definitely.
for for our people. Yeah.
The only difference between my culture and yours is that we happen to have sterile gauze at our fingertips. That's I feel like that's the only difference, that there's a wealth of knowledge on both sides, and the thought that
Hmm.
an NGO coming in with the intention of helping is actually hindering, that's pretty
Yeah,
heartbreaking. But it's
that's
also
true.
encouraging.
Supply.
Yeah, it's
So,
encouraging though to see people like you who are taking these resources and growing them, because what you do is, and your daughters and what they see you do, and then they take that to their daughters and their neighbors, and that's that's the best.
yeah. So even in my community, a lot of the moms around here are my clients. I see them when they are having a baby. I I help them. So a lot of the babies, are born in my hand, and they
Oh,
are my babies.
they
Yeah,
are your baby.
a
Oh,
lot
my
of.
babies. I just So in full disclosure, I actually haven't talked to Marcia in 5 years, and I just got to meet my baby. The baby
There
I'm
you go.
Yeah, she's
There
my
you go. You
baby.
see?
Yeah, you do. You
Mhm.
have connection with your babies.
Yeah.
Yeah.
Yeah. So I have my babies all around my community. When I pass, they say, "Hi, Auntie Marcia. Hi, Auntie Marcia." So
Oh, love it.
I tell them, "Guess what? Did your mom tell you that I was the first to hold you?" They say, "Oh yes,
Uh-huh.
you tell." Yeah.
I know. I
So,
almost told your daughter I was the first one to see you, even before your mama, but I didn't. She's only 5. I don't know how that would go, but yeah, no,
yeah.
I feel this connection to my babies, and so that's probably one of the big draws of midwifery, is that connection you have with the family.
Yeah.
Yeah.
So sweet. Yeah, that's true.
So how, again, I haven't I we didn't have a pre-conversation, Marcy and I filmed her birth, and she made such an impression on me when she was here teaching at the school of midwifery, and a lot of the choices I've made have been guided by what I learned from Marcia 6 years ago. And so tell, like, how can we as a birth community here, how can we directly support you right now today? What are you in need of? How do we get you the things you need without going through all these, I hear you're not supposed to ship things because things never turn out where they are supposed to go. So how do we help?
So, Sarah, seriously, honestly speaking to you, just just everything you can. You think that a nurse or a midwife we need, and guess what? D sent a full further continue during the Ebola crisis to Liberia. The
Hmm.
inundated. She sent gauze, she sent glove, she sent antiseptic, she sent boots, she sent PPE. So it's not you don't have to send money, but if you can just gather just materials, equipment, tools, the scissors, the clamp. If we can have a small ultrasound machine, if you can just pack a container with just medical supplies, PPEs, glove, gauze, alcohol.
And can we ship these to you without being stolen or anything? We can.
Yeah, you can ship them. You can ship them
Mm,
without being stolen. You can ship them, yes. D
awesome.
did that. D did that. D sent a full photo continue to Liberia. There were a lot of supplies. D did that.
And
Yes.
do you have a PayPal or way that people can send you money?
Yes, you talk about PayPal. You remember I was there even when we had those little program and thing. Sherry advised me, and I opened an account there. I still have an account with Wells Fargo there where I send money. In fact, guess what? I started the deuterium thing with Sherry. Liberians, they love the oil, the deuterium oil.
Hmm.
So yes, I have PayPal. You can send that. You can wire money through the bank, and that will be fine. But I don't want you to focus on money first. Whatever way, whatever help you want to help, if you start with supplies, Sarah, I will be
Mm.
grateful.
Okay, so
Supply.
we need to get your shipping information so we can put it with the episode, so we can organize something. Maybe we could do something here where um, the supplies are either sent or the money sent us. We purchase them and then we can send them to you. Yeah,
Fine, we can work on that. I will work on that. That's why I said let's continue to communicate. We can work on that and see how we can get that going. I will
yeah.
be glad. I will
So,
be glad.
Birth Circle also has a nonprofit arm. It's called the Empowering Fearless Birth Foundation. It's a nonprofit here in the United States, and that PayPal address is donate at Empowering Fearless Birth. And I know one of the things, donate at empoweringfearlessbirth.com. And I know that one of the things that we talked about when you were here in 2014 was taking video of a lot of the things that were going on. But even 6 years ago, access to video wasn't like it is now. So
No, no, no.
I would say it would be really fun to do a campaign here to gather some things for you and then send them over and have you do a video of them being received and how they're going to be um, distributed.
Distributor, how gonna be you?
Yeah. And then I would love to learn more about the culture and the skills of the midwives there.
I would like to do that. And just like I say, when all of these things are going on, Sarah, I would love for you to come.
Oh
I
yeah, I'll
would
be
love
there.
for you.
I'll be there. Mark my words. When you're allowed to travel again.
I know.
Oh, it's
Yeah.
crazy. Wow. Thank you so much. I really appreciate it. Like I'm so grateful I get to introduce you to my world.
No
This is
problem.
Marcia. She's the coolest. And yep, and this is the start of something. Well, we met in 2014, but you've always been on my mind. And I say the first country that we leave, the first country we go to after the United States birth circle is Liberia. I have a
Liberia.
connection in Liberia, and that's the first country we're gonna go. And birth circle
Wow.
is we're going places.
Thank you so much. And when I went to America too, the families I met are Sherry and Dee and Sonja, and they told me, Marcia, you can always come when you can because Utah is your second home. I said, wow,
Yep.
thank you.
Oh
Yes.
yes.
Yeah.
Yep, I know. Dumb COVID. Okay, we'll do an exchange. You'll come here for a while and we'll pack you up and send you home with a ton of stuff, and I'll come there packed with
I
everything.
would love to. I would love to. I would love to.
Yeah.
Thank
Thank
you so
you.
much. Thank you so much, Sarah. Let's keep in touch. I'm going to work on all I can work on, and I'm going to communicate with you more so that you can see how you guys can help me to move our place.
Yep.
My country, yeah, my country
And
really
there's
need help.
so much that you can help us with too. That's what I love about this connection. It's not just a, hey, let's donate and throw some money at the problem. It's okay, we have the gauze, but you have the culture and the community. You can teach us so much too.
Yeah, yeah,
I love it.
okay.
Thank you.
Thank you so much. Thank you so much. Thank you, Sarah. Okay. Bye bye. Another time, anytime.
Yeah.
Please visit us at birthcircle.com, join our Facebook groups, or find us on Instagram and Pinterest. We hope you'll use our resources to support your birthing experience.